energy. Stephen C. Drago takes Jeffrey P. Introduction A. Overview 1. Nuclear pharmacy is defined as a patient-oriented service that embodies the scientific knowledge and professional judgment required to improve and promote health through the safe and efficacious use of radioactive drugs for diagnosis and therapy. 2. Radiopharmaceuticals are drugs that contain a biological moiety and a radioactive element. The biological construct targets a physiological or pathophysiological process of interest, allowing the localization of radiation that, in turn, may be imaged or used to affect therapy. Most radiopharmaceuticals are used in diagnostic medical imaging. However, they are also used in therapeutic applications, such as in the treatment of hyperthyroidism, thyroid cancer, polycythemia vera, and in the alleviation of bone pain. 2-3. Nuclear pharmacy practice entails the following. A. Procurement of radiopharmaceuticals. B. Compounding of radiopharmaceuticals. C. Performance of routine quality control procedures. D. Dispensing of radiopharmaceuticals. E. Distribution of radiopharmaceuticals. F. Implementation of basic radiation protection procedures and practices. G. Consultation with and/or education of the nuclear medicine community, patients, pharmacists, other health professionals, and the general public regarding the following. 1. Physical and chemical properties of radiopharmaceuticals. 2. Pharmacokinetics and biodistribution of radiopharmaceuticals. 3. Drug interactions and other factors that alter patterns of distribution. H. Monitoring of patient outcomes. I. Research and development of radiopharmaceuticals. 3b. Properties of radiopharmaceuticals. 1. Pharmacological effects. Typically, radiopharmaceuticals lack pharmacological effects because the mass quantities range from picogram, pg to nanogram, ng per kilogram, kg of administered dose. 2. Route of administration. Most radiopharmaceuticals are prepared as sterile, pyrogen-free intravenous solutions or suspensions to be administered directly to the patient. Other routes of administration include intradermal, oral, interstitial, and inhalation, for example, radioactive gases, aerosols. 3. Radionuclides. The radioactive component of a radiopharmaceutical is referred to as a radionuclide. Nuclides are identified as atoms having a specific number of protons and neutrons in the nucleus. A nuclide is typically identified by the chemical symbol of the element with a mass number shown as a superscript, indicating the sum of protons and neutrons. For example, iodide-131 is indicated as 131I. When the atom is radioactive, it is called a radionuclide. B. Radionuclides undergo spontaneous radioactive decay, accompanied by the release of energy. The distribution, metabolism, and elimination of the radiopharmaceutical can be determined. Nuclear pharmacy. Stephen C. Drago takes Jeffrey P. Norenberg. Nuclear pharmacy. By measuring this energy with imaging equipment, there are 4 major types of radiation emitted through this process: A, B, G, and X-rays. A and B radiations are not useful in medical imaging and are, therefore, undesirable in diagnostic applications. Most diagnostic radiopharmaceuticals use penetrating G radiation, which can be easily detected and converted into imaging data. 4. Half-lives of radiopharmaceuticals. The physical half-life of a radiopharmaceutical is the amount of time necessary for the radioactive atoms to decay to 1/2 their original number. Each radionuclide is characterized by a specific half-life that is a physical constant. B. The biological half-life of a radiopharmaceutical is the amount of time required for the body to metabolize or eliminate 1/2 of the administered dose of any substance through biological processes. The effective half-life of a radiopharmaceutical is the time required for an administered radiopharmaceutical dose to be reduced by 1/2 as a result of both physical decay and biological mechanisms. It is defined as T5, TP1TB, TP3TB, where T is the effective half-life, TP is the physical half-life, and TB is the biological half-life. C. Optimal radiopharmaceuticals 1. Optimal diagnostic radiopharmaceuticals should contain a radionuclide with a half-life short enough to minimize radiation exposure to the patient, yet long enough to allow for collection of imaging information. The optimal relationship is a physical half-life equal to approximately 67% of the biological process of interest. B. Should incorporate a G-emitting radionuclide, which decays with the emission of a photon energy between 100 and 300 kiloelectron volts, keV, which is efficiently detected with current instrumentation. C. Should contain a biological component that allows rapid localization in the organ system of interest and be metabolized or excreted from the non-target tissues. To maximize contrast and minimize the radiation absorbed dose to non-target organs. D. Should be readily available and cost-effective too. Optimal therapeutic radiopharmaceuticals, in addition to 1C1C, should contain A or B emitting radionuclides that can effectively deliver radiation in quantities sufficient to cause the desired therapeutic effect. Such effects include apoptosis, DNA damage, or irreparable cell damage leading to tissue effects. 4. Second, sodium pertechnetate technetium 99 meters, 99 NTC generator. Overview 1. Technetium 99 meters 99 NTC. The most commonly used radionuclide in diagnostic imaging today is produced by the radioactive decay of molybdenum 99 to 99 A. 99 MTC is obtained via commercially supplied, sterile, pyrogen-free generator systems. A generator is a device used to separate a short half-life radionuclide from the longer-lived parent nuclide while retaining the parent to produce more of the daughter nuclide. In this way, short half-life nuclides can be made available continuously at great distances from the sites of generator production. B. All of the commercially supplied generators currently use 99 obtained from the fission of uranium-235-235 U. This 99 parent is absorbed on an alumina Ul-2-3 ion exchange column, and the 99 MTC formed from its decay is exchanged for the chloride ion, available in the 0.9% saline eluate solution washed through the column, as the sodium pertechnetate NaOH 99 MT CoFer2 forms. 2. The chemical valence state of the technetium atom within the sodium pertechnetate molecule, NaOH 99 MT CoFer2, as it is eluted from the column, is 17. Typically, it must be reduced to a lower valence state before it is able to react with other compounds. Although many processes can reduce 99 NTC, the Stannis ion reduction method is most commonly used in 99 MTC radiopharmaceutical kits. A radiopharmaceutical kit consists of sterile, pyrogen-free vials containing a reducing agent, the compound to be labeled, and any additional adjuvants necessary to effect the reaction or to stabilize the labeled product. 1162 Chapter 59-2. B. In most cases, they are lyophilized under inert atmospheres to minimize the oxidation of the reducing agent, for example, SN11. B. Sodium pertechnetate 99 NTC USP. United States Pharmacopoeia, Na 199 MT Co 42. As emitted from a generator in 0.9% sodium chloride, NaCl solution, is an isotonic, sterile, non-pyrogenic, diagnostic radiopharmaceutical suitable for IV injection, oral administration, and direct instillation. 1. Physical properties. The solution should be clear, colorless, and free of visible foreign material. The pH is 4.5 for 7. B. Na 199 MT Co 42 is itself a radiopharmaceutical, or it may be used to radiolabel all other 99 MTC radiopharmaceuticals. 2. Biodistribution. A 99 MT Co 42 is handled by the body in a fashion similar to 131.9, that is, it is taken up and released but not organified by the thyroid. B. After IV administration, 99 MT Co 42 concentrates in the choroid plexus, thyroid gland, salivary gland, and stomach, but remains in the circulation long enough for first-pass blood pool studies, organ perfusion, and major vessel studies. C. It is primarily excreted by the kidneys unchanged, and is expressed in the urine 15% to 50% by 24 HRS. D. Between 10% and 55% of the administered dose is eliminated via feces within 3 days. 3. Decay data. A 99 MTC decays by isomeric transition with a physical half-life of 6 HRS. B. The primary radiation emissions are 140 keV energy photons. 4. Purity. A USP radionuclidic purity requires a 99 mO breakthrough limit of 0.15 MCI of 99 MTC at the time of patient administration. B. USP chemical purity requires an aluminum ion, Al13, test result of less than 10 mg CML. 5. Administration and dosage. All of the following imaging studies are administered via 4, except nasolacrimal imaging, which is instilled into the lacrimal canal. Brain imaging, 10 to 20 MCI, 370 to 740 megabecquerels, MBQ-B. Thyroid imaging, 1 to 10 MCI, 37 to 370 MBQ-C. Salivary gland imaging, 1 to 5 MCI, 37 to 185 MBQ-D. Placenta localization, 1 to 3 MCI, 37 to 111 MBQ-E. Blood pool imaging, 10 to 30 MCI, 370 to 740 MBQ-F. Urinary bladder imaging, 0.5 to 1 MCI, 18 to 37 MBQ-G. Nasolacrimal imaging, urinary MCI. Third, radiopharmaceuticals for cardiovascular imaging. Perfusion agents for cardiac imaging. Radiopharmaceuticals are useful in cardiac imaging as agents that provide information on the regional myocardial blood perfusion. They typically are administered as part of a cardiac stress test to provide information at peak cardiac output. The patient will run on a treadmill to stress the heart. IV coronary vessel dilating agents are used in place of the treadmill when the patient is not physically able to exercise. Examples of these pharmacological agents are dipyridamole, adenosine, and dobutamine. The patient will also be imaged when the heart is at rest. 1. Thallus chloride thalliuminous 201 ETL is a radionuclide that is produced by a cyclotron. It is used for myocardial perfusion imaging in the diagnosis of coronary artery disease and localization of myocardial infarction. Biodistribution 201 ETL is a monovalent cation with distribution analogous to a potassium ion. Myocardial uptake is by active transport via the naonicone adenosine triphosphatase. At pace pump. 2. Biodistribution is generally proportional to organ blood flow at the time of injection, with blood clearance by myocardium, kidneys, thyroid, liver, and stomach. The remainder is distributed uniformly throughout the rest of the body. 3. 201 ETL is excreted slowly and equally in both urine and feces. B. Decay data. 1. Physical half-life. 73 HRS. 2. Effective half-life. 2. 4 days. Biological half-life. 11 days. 4. Primary radiation emissions. 68 to 80 keV X-rays and 167 and 135 keV G energy photons. C. Administration and dosage. IV 2 to 4 MCI, 74 to 148 MBQ 2. 99 MT system maybe 89 NTC maybe exists as a sterile, pyrogen-free IV injection after kit reconstitution with Na 199 MT Co42 and heating at 100 C for 10 mins. A. Biodistribution. 99 MTC maybe is a cation complex that has been found to accumulate in viable myocardium by passive diffusion into the myocyte with subsequent binding to the mitochondria within the cell. 2. The major pathway for clearance of 99 MTC system is the hepatobiliary system. This agent is excreted without any evidence of metabolism via urine and feces. B. Decay data. 1. Effective half-life. 3. HRS, myocardium. 2. Biological half-life. 6. HRS, myocardium. C. Administration and dosage. 10 to 30 MCI, 370 to 1,110 MBQ. 3. 99 NTC tetrophosmin exists as a sterile and pyrogen-free IV injection after kit reconstitution with sodium pertechnetate 99 MTC injection USP. Description. 99 NTC tetrophosmin is a lipophilic, cationic 99 NTC complex that has been found to accumulate in viable myocardium. B. Biodistribution. The major pathways for clearance of 99 MTC tetrophosmin are the renal system and the hepatobiliary system, with 2006% of the administered dose excreted in the feces and 40% excreted in the urine within 48 HRS. C. Physical properties. C2A. D3. D. Administration and dosage. IV. During exercise, 5 to 8 MCI, 185 to 296 MBQ. During rest, 15 to 24 MCI, 555 to 1D. 4 rest during rest. Rubidium 82 80 twerb. Chloride is a generator-produced radiopharmaceutical obtained by the decay of its accelerator-produced parent strontium. 82SR. Half-life is 25 days, adsorbed on a stannous oxide column. Biodistribution. 1. When eluted with 0.9% NaCl at a rate of 50 ml/min. A solution of the short-lived daughter 80 twerb is eluted from the generator for direct IV administration. 2. After IV administration, 80 twerb rapidly clears from the blood and is extracted by the myocardial tissue in a manner analogous to cone. 3. Myocardial activity is visualized within 1 min after administration. B. Decay data. 1. Physical half-life. 75 SECs. 2. The decay mode is by positron emission. 3. The primary radiation emissions are annihilation 511 keV G energy photons. 4. Parent 82SR and contaminant 85SR breakthrough must be closely monitored. Acceptable levels of strontium breakthrough are 0.02 MCI 82SR MCI 80 twerb and 0.2 MCI 85SR MCI 80 twerb. C. Administration and dosage. IV 30 to 60 MCI, 110 to 2220 mbq5. Ammonia-3 exists under a USP monograph as an on-site cyclotron-produced sterile Thor solution of 13, useful as a myocardial perfusion agent. After June 2012, it will be available as a FDA-approved drug. Decay data, 1 physical half-life, 10 mins, 2 decay mode. Positron emission resulting in the production of 2 511 keV annihilation photons B. Biodistribution, 1 after IV injection. It circulates as 13H3 but localizes into the myocytes via diffusion as 13H3. It is then metabolized to glutamine and retained by the myocytes. Nuclear. Pharmacy 1163, 1164, Chapter 59, the third. After IV injection, it is cleared rapidly from the blood. 2% of the administered dose remains 5 mins post-injection. 3. It is predominantly metabolized to 13-glutamine by different organs of the body. 4. Between 10% and 20% is excreted via the renal system. C. Administration and dosage. IV, 15 to 20 mCi, 555 to 740 mbq. B. Agents used to measure cardiac function. Regional myocardial wall motion. 1. 99 mTc labeled red blood cells, 99 mTc RBCS, are used for blood pool imaging, including cardiac first pass and gated equilibrium imaging, regional cardiac wall motion. A. Physical properties. Autologous RBCs can be labeled by several techniques that use the SN11 radiolabeling method with 3 general steps. 1. The cells are treated with SN11 to provide an intracellular source of the reducing agent. This step can be carried out with either in vivo or in vitro labeling procedures. 2. The next step is the removal of excess SN11, either by chemical oxidation, in vitro method, or by biological clearance, in vivo method. 3. All of the methods include the addition of sodium pertechnetate, 99-MtCO42. This 99-MtC, while in the 17-valent state, crosses the intact erythrocyte membrane and binds to intracellular hemoglobin, HB, after being reduced by the available intracellular SN11. B. Biodistribution. After IV injection, the labeling RBCS distribute within the blood pool and are well maintained in the blood pool, with a biexponential whole-body clearance of 2.5 to 2.7 HRS and 75 to 176 HRS. For example, major route of excretion is via the urine. C. Administration and dosage. IV 10 to 20 mCi, 370 to 740 mbq. 2. Pyrophosphate injection USP and phosphates USP. The major use for these agents in nuclear medicine is as convenient and stable sources of SN11 for the labeling of autologous RBCS. In this application, the kits are reconstituted with normal saline and injected via 4th, skeletal imaging. Skeletal imaging agents. 1. Overview. 99-MTC labeled bone imaging agents are useful in the detection of bone lesions that are associated with metastatic neoplasms, metabolic disorders, and infections of the bone. The imaging advantages of 99-MTC, coupled with the sensitivity of bone imaging agent localization in skeletal bone hydroxyapatite, allows for detection of bone pathology before evidence is shown by conventional X-rays. 2. 99-MTC bone agents. There are many different forms of 99-MTC bone agents, with minor differences in their individual chemical structure. Currently used bone imaging agents are based on either the P-diphosphonate structure, including 99 mTc medronate disodium and 99 mTc oxygenate, or the inorganic P-O P phosphate structure, such as 99 mTc pyrophosphate. These bone agents are Sullivan reduction method kits, which exist as sterile, pyrogen-free IV radiopharmaceuticals after reconstitution with Na199-MTCO42. Physical properties. 1. All of the 99 mTc bone imaging agents are susceptible to radiological decomposition, with reoxidation of the 99 mTc to a higher valence state. These agents sometimes include antioxidants, for example, ascorbic or gentisic acid, in their formulation to improve their in vitro stability. 2. They should be stored at room temperature before and after reconstitution. B. Biodistribution. 1. It is believed that the localization of the diphosphonates occurs by chemisorption onto the hydroxyapatite mineral matrix of skeletal bone, with uptake related to bone metabolic activity and bone blood flow. 2. For 99 mTc medronate disodium and 99 mTc oxygenate, approximately 50% of the administered dose localizes in the skeleton, and 50% is excreted by the kidneys within the first 4 to 6 HRS after IV injection. C. Administration and dosage. IV, 10 to 20 MCI, 370 to 740 mBq/b. Bone marrow imaging. C. VA1, VIA3, VIB-V. Lung imaging. Radiopharmaceuticals are used to evaluate both pulmonary perfusion and pulmonary ventilation to detect pulmonary embolism and to assess pulmonary function before pneumonectomy. Pulmonary perfusion imaging. 1. 99 mTc albumin aggregated, 99 mTc Ma. Physical properties. 1. 9 mTc albumin aggregated kit contains human serum albumin, say that has been aggregated by heat denaturation. 2. This Sullivan reduction method kit exists as a sterile, pyrogen-free suspension of radiolabeled aggregated particles after reconstitution with Na199 mTO42. 3. It should be stored at 2 to 8 cc after reconstitution. B. Biodistribution. On after IV administration of 99 mTc albumin aggregated, 80% of the radiolabeled albumin particles become trapped by capillary blockade in the pulmonary circulation. 2. After trapping, the particles are cleared from the lungs mainly by mechanical breakup. These smaller particles are ultimately cleared from the circulation by the reticuloendothelial system. 3. Particle size should be controlled, that is, 90% of the particles should be between 10 and 90 megameters, and none should be 150 megameters, to ensure adequate trapping by the lung capillary bed but no occlusion of the large bore vessels. 4. Particle number should be between 200,000 and 700,000 particles per adult dose to obtain uniform imaging data without compromising capillary blood flow. Neonates should receive 125,000 particles. C. Decay data. Biological half-life in the lung, 2 to 3 HRSD. Administration and dosage. IV, 1 to 4 MCI. 37 to 148 mBq/b. Pulmonary ventilation imaging with radioactive gases is a routine nuclear medicine procedure that can provide valuable information about regional lung ventilation. Radiopharmaceuticals used are either radioactive gases or radioaerosols. 1. Xeno-133 133 is supplied as a radioactive gas contained in glass septum vials to be administered by inhalation through a closed respiratory system or a spirometer. It is a byproduct of 235U fission. Biodistribution. 133X is a readily diffusible gas, which is neither used nor produced by the body. It passes through membranes and freely exchanges between blood and tissue, tending to concentrate more in body fat. 2. Inhaled 133x distributes within the alveoli and enters the pulmonary venous circulation via the capillaries. Most of the absorbed 133x is returned and exhaled from the lungs after a single pass through the peripheral circulation. 3. In concentrations used for diagnosis, the gas is physiologically inactive. B. Decay data, 1 effective half-life in the lung. 2 mins, 2 physical half-life, 5, 2 days, 3 Tay mode. B minus and G decay. 4 primary radiation emissions, 100 keV B energy and 81 keV G energy photons C. Administration and dosage. Inhalation 2 to 30 MCI, 74 to 1000, 110 MBq. 2. Radioaerosols have become increasingly used with the advent of nebulizers that produce particles of a consistent size necessary for uniform lung distribution. Biodistribution, where 99 NTC pentate, 99 NTC DTPA, radioaerosols of approximately 0.25 megameters mass median aerodynamic diameter are useful in determining lung ventilation. 2. After deposition of the nebulized droplets within the airways, the 99 MTC pentatate is absorbed into the pulmonary circulation. 3. The material is subsequently excreted by the kidneys. Clearance from the lungs is sufficiently slow to allow for imaging of the lungs in multiple projections from a single administration. B. Physical properties. C2233. C. Administration and dosage. Inhalation 30 MCI 1110 MBq nuclear. Pharmacy 1165. 1166 Chapter 59 People. Vi. Hepatic imaging. Overview. Hepatic imaging requires the use of 2 different classes of radiopharmaceuticals to evaluate the 2 cell types responsible for hepatic function. 1. Reticuloendothelial system imaging. The liver, spleen, and bone marrow are evaluated with radio-labeled colloidal material, ranging in size from 0.1 to 3 megameters. These particles are rapidly cleared from the blood by phagocytosis by the Kupffer cells or trapped in the space of decay, which is found between the polygonal hepatocytes and the Kupffer cells. 2. Liver-spleen imaging. Radiopharmaceuticals are useful in imaging space-occupying primary tumors and metastatic neoplasms as well as hepatic defects caused by abscesses, cysts, and trauma. 3. Bone marrow imaging. Images that localize in the bone marrow are useful in the evaluation of pathologies that affect bone marrow. 4. Hepatobiliary imaging. Hepatocyte function can be evaluated by substances meeting requirements of molecular weight, lipophilicity, and chemical structure to be excreted by the polygonal cells into the hepatobiliary system. Hepatobiliary imaging radiopharmaceuticals are useful in the diagnosis of cystic duct obstruction, in acute cholecystitis, as well as defining post-cholecystectomy anatomy and physiology. B. Reticuloendothelial imaging agents 1. 99-NTC sulfur colloid 99-NTC2 second 7 is a sterile, pyrogen-free, IV radiopharmaceutical formed via a chemical reaction between 99-MTCO42 and an acidified solution of sodium thiosulfate at 100 C. A. Physical properties 199-MTC2 second 7 is thought to remain in the 17-valent state as the heptasulfide coprecipitate of elemental sulfur that occurs during the reaction. 2. The use of NAMCO with all 13 levels. 10 mg/ml can lead to the formation of particles. 5 megameters, which can result in lung uptake. 3. Heating time should be controlled to preclude large particle formation. B. Biodistribution. After administration, 80% to 90% of the dose is phagocytized by the Kupffer cells of the liver or trapped in the space of decay, 5% to 10% by the spleen, and the balance by the bone marrow. The blood clearance half-life is approximately 2.5 mins. Particles are not metabolized and reside in the reticuloendothelial system for a prolonged period. C. Administration and dosage. IV, liver spleen, 1 to 8 mCi 37 to 296 mbq. Bone marrow, 3 to 12 mCi 111 to 444 mbq. C. Hepatobiliary imaging agents 1. Overview. A. Immunodeacetic acid, IDA derivatives, which are lidocaine analogs, are useful as hepatobiliary imaging agents because of their lipophilicity, which allows them to be selectively cleared by carrier-mediated hepatocyte metabolic pathways. Because these agents share the same excretion pathway as bilirubin, patients who have increased bilirubin levels exhibit decreased hepatic clearance and an increased renal clearance. Lack of gallbladder visualization is an abnormal finding, suggesting acute cholecystitis. B. Cholecystokinetic agents, such as syncolide and cholecystokinin, may be used to empty the contents of the gallbladder in fasting patients before injection of IDA compounds in an attempt to promote gallbladder filling and visualization. These agents can also be injected after the injection of the IDA compound to cause a visualized gallbladder to empty. Cholecystokinetic agents are used to increase the specificity and sensitivity of the imaging procedure. C. Narcotic analgesics, such as morphine, have been used to constrict the sphincter of Oddi to produce increased intraductal pressures to promote retrograde gallbladder filling. Two, 99 MTC disulfin, 99 NTC diceta. Physical properties. C2B3. B. Biodistribution. 999 NTC diceta is rapidly cleared from the blood. 8% remains in the blood after 30 mins. 2. Approximately 9% of the administered activity is excreted in the urine during the first 2 HRs. The remainder of the activity is cleared through the hepatobiliary system. 3. Peak liver uptake is within 10 mins. Peak gallbladder uptake is by 30 to 40 mins. 4. Gallbladder and intestinal visualization occurs within 60 mins post-administration. C. Administration and dosage. IV, non-jaundiced patient, 1 to 5 mCi 37 to 185 mbq. Jaundiced patient, 3 to 8 mCi 111 to 296 mbq. 3. 99 mTC. Mebrafenin A. Physical properties. C. T2B3. B. Biodistribution. By 99 mTC mebrafenin is rapidly cleared from the blood. 17% remains after 10 mins. Only 1% of the administered activity is excreted in the urine within the first hours. The remainder of the activity clears through the hepatobiliary system. 2. Peak liver uptake occurs within 10 mins. Visualization of the hepatic duct and gallbladder within 10 to 15 mins. Then intestinal activity within 30 to 60 mins. C. Administration and dosage. IV, non-jaundiced patient, 2 to 5 mCi 74 to 185 mbq. IV, jaundiced patient, 3 to 10 mCi 111 to 370 mbq. 7th, renal imaging. Overview 1. Radiopharmaceuticals are used in renal imaging to determine renal function, renal vascular flow, and renal morphology. They are also useful for the evaluation of renal function in post-transplant patients for complications such as obstruction, infarction, leakage, tubular necrosis, and rejection. 2. The use of radiopharmaceuticals to determine renal function or renal morphology is based on the two physiological mechanisms responsible for excretion: glomerular filtration and tubular secretion. B. Agents cleared by glomerular filtration are useful in determining the glomerular filtration rate, GFR, renal artery perfusion, and the visualization of the collecting system. 1. 99-NTC pentate, 99-NTC DTPA. Physical properties, C2B3. B. Biodistribution. 1. After administration, 99-MTC pentate rapidly distributes throughout extracellular fluid space, from which it is rapidly cleared by glomerular filtration only. 2. Up to 10% may be protein-bound, leading to a decrease in measured GFR. 3. After administration, 50% of the dose is cleared by the kidneys within 2 HRS, and up to 95% is cleared by 24 HRS. C. Administration and dosage. IV 10 to 20 MCI 370 to 740 MBq. 2. Sodium iothalamate iodineminis 125-555I. Injection is a commercially supplied, sterile, pyrogen-free injection containing 1 mg sodium iothalamate per milliliter. E. Biodistribution. Sodium iothalamate 125I is used for determination of the GFR, but not for imaging because of poor imaging emissions of 125I. 2. Thyroid blockade with oral potassium iodide. Key is suggested. B. Decay data, 1. Physical half-life, 59 days. Decay mode by electron capture, 3. Primary radiation emissions, 35 keV energy photons, and X-ray C. Administration and dosage. Over 10 to 50 MCI 37 to 18.5 MBq/c. Tubular secretion agents are used to evaluate renal tubular function and measure effective renal plasma flow. 1. 99-MTC merciatide, 99-MTC mag3. A. Description: 1. Supplied as a sterile, pyrogen-free, lyophilized kit containing betiotide, precursor of merciatide, and chelation adjuvants. 2. After the sodium pertechnetate is added to the kit, it must be heated in a hot water bath or heating block at 100 C for 10 mins to form 99-MTC merciatide from the betiotide precursor. B. Biodistribution. Merciatide is renally excreted. 90% of the administered dose is excreted within 3 HRS post-injection. Nuclear. Pharmacy 1167. 1168 Chapter 59 The C. E. It is primarily cleared via active tubular secretion, and to a small extent via glomerular filtration. C. Physical properties. C2B3. D. Administration and dosage. 5 to 10 MCI, 185 to 370 MBq. D. Renal cortical imaging agents are used to evaluate renal anatomy because of their ability to accumulate in the kidney and provide anatomical imaging data. 1. 99-MTC cystimer, 99-NTC DMC. A. Physical properties. 1. CIIB. 2. 99-MTC cystimer complex must be allowed to incubate for 10 mins post-reconstitution and must be used within 4 HRS post-incubation. B. Biodistribution. 1. Within 3 to 6 HRS post-administration. 40% to 50% of the dose localizes in the renal cortex, where it is taken up by the tubular cells. 2. Excretion into the urine is slow. 5% to 20% is excreted within the first 2 HRS, 10% to 30% by 6 HRS, and 40% by 24 HRS. C. Administration and dosage. IV 2 to 6 MCI, 74 to 222 MBq. 8. Thyroid imaging. Overview 1. The basic function of the thyroid gland is the production of thyroid hormone for the regulation of metabolism. The thyroid hormones are produced within the gland through the organification of iodine, obtained from the oxidation of available iodides circulating in the blood. The inability of the body to distinguish between the isotopes of iodine provides a perfect metabolic tracer for the thyroid biochemical system. 2. The function of the thyroid gland can be evaluated by the uptake of 131I or 123I, allowing the detection of hypothyroidism with decreased uptake and hyperthyroidism with increased uptake. 3. 99-MTCO42 is a monovalent anion with an ionic radius similar to iodide. As a result, the pertechnetate ion is trapped by the thyroid gland in a fashion similar to iodide. The two species are sufficiently different in that 99-MTO42 is not organified nor incorporated into thyroid hormone, and it is subsequently released unchanged. B. Thyroid imaging agents. 1. Sodium iodide iodine 123, 123I, is a radiopharmaceutical available in either solution or capsule form for oral administration. It is produced by a cyclotron. Biodistribution. 1. Orally administered iodine is rapidly absorbed from the gastrointestinal G tract. Thyroid gland uptake is evident within minutes. 2. Sodium iodide 123I is considered an ideal radiopharmaceutical for iodine uptake and imaging studies because of its short half-life and useful 159 keV primary G emissions. B. Decay data. 1. Physical half-life 13.2 HRS. 2. Biological half-life 3.5 days. 3. Decay mode by electron capture. 4. Primary radiation emissions 159 keV, 27 keV, and 529 keV G energy photon C. Administration and dosage. Oral thyroid uptake 100 to 200 MCI, 3.7 to 7.4 MBq. Thyroid image 100 to 500 MCI, 3.7 to 18.5 MBq. 2. Sodium iodide 131I is used for thyroid uptake and imaging studies. However, it is now used less often because of the high radiation dose absorbed. Biodistribution. 1. Orally administered iodine is rapidly absorbed from the GI tract. With thyroid gland, uptake is within minutes. 2. Sodium iodide 131I is not considered an ideal radioiodine radiopharmaceutical for iodine uptake and imaging studies because of its long half-life, poor imaging properties, and the high radiation dose to the thyroid from its B decay component. 3. The radiation dose from the high-energy B particle, with the imaging potential of its G emissions, make this radionuclide the agent of choice for therapeutic treatment of hyperthyroidism and thyroid cancer. B. Decay data. 1. Physical half-life 8.08 days. 2. Decay mode by B decay. 3. primary radiation emissions. 606 keV and 333 keV B energy. 364 keV, 637 keV, and 284 keV G energy photon C. Administration and dosage. 131I is available as either a capsule or in solution for oral administration. 1. Diagnostics of thyroid uptake. 2 to 15 MCI. 0.074 to 0.55. 5 MBq thyroid image. 30 to 50 MCI. 1.1 to 1.85 MBq. See whole body image. 1 to 5 MCI. 37 to 185 MBq. 2 therapeutics. Hyperthyroidism. 10 to 30 MCI. 370 to 1,110 MBq. D. Thyroid carcinoma. 50 to 200 MCI. The separate MBq 100. No 199 MCQ 42. C2B 4. 201 ETL. Parathyroid imaging biodistribution. 201 ETL concentrates in the thyroid and also in parathyroid adenomas, which can be detected by a dual isotope subtraction technique of subtracting thyroid uptake counts from Na199 MT-CoFer2 to unmask non-thyroid thallium uptake counts. See 301. B. Administration and dosage. IV 2 MCI 74 MBq. IX brain imaging. A. Cerebral perfusion brain imaging agents. Radiopharmaceuticals for evaluating brain perfusion must possess a lipophilic partition coefficient sufficient to diffuse passively across the blood-brain barrier, BBB almost completely, within one pass of the cerebral circulation, as well as being sufficiently retained to permit data collection. The regional uptake of these agents is proportional to cerebral blood flow. This class of radiopharmaceuticals is useful in the diagnosis of altered regional blood perfusion in stroke. 1. 99-NTC hexametazime. 99-NTC-HMPO exists as a sterile, pyrogen-free IV injection after reconstitution with sodium pertechnetate USP, which may be stabilized with the addition of a methylene blue phosphate buffer stabilizing solution. A. Description: 199-NTC hexametazime is a neutral, lipid-soluble complex that freely crosses the BBB. This is a relatively unstable complex, which rapidly converts to a secondary, less lipophilic complex incapable of penetrating into the brain. The in vitro addition of a methylene blue phosphate buffer stabilizing solution after preparing the 99-NTC hexametazime will stabilize the lipid-soluble complex for 4 HRS. 2. Additional limitations on kit preparation parameters require the use of high mole fraction technetium generator eluates of 2 HRS post-solution from a generator previously eluted within 2004 HRS. B. Biodistribution: 99-NTC hexametazime rapidly clears from the blood, with a maximum brain uptake of 3.5% to 7%, and up to 2.5% remaining after 24 HRS. 2. The activity is widely distributed throughout the body. 30% distributes to the GI tract. 3. Within 48 HRS, 40% of the dose is excreted through the urine and 15% is eliminated via the feces. C. Physical properties. C2B3. D. Administration and dosage. B. 10 to 20 MCI, 370 to 740 MBq. 2. 99 MTC base 99 MTC ECD. 99 MTC base ZM. Pyrogen-free IV injection after reconstitution with sodium pertechnetate 99 MTC USP and the addition of a phosphate buffer, nuclear. Pharmacy 1169. 1170 Chapter 59. Diag. A. 2. After reconstitution, a stable lipophilic 99 MTC bispecific complex is formed, which is able to cross the triple B by passive diffusion. B. Biodistribution. 99 MTC bispecific is rapidly cleared from blood. A maximum of 6.5% of the administered dose is localized in the brain, and 5% is left in the blood after 1 hour. 2. Once located in the brain cells, 99 NTC bispecific is metabolized by endogenous enzymes to a polar compound that is unable to diffuse out of the brain cells. 3. 99 MTC bispecific is primarily eliminated via the kidneys. 50% is excreted within 2 HRS and 74% in 24 HRS. Hepatobiliary excretion accounts for approximately 12.5% of the administered dose after 48 HRS. C. Radionuclide properties. C2B3. D. Administration and dosage. 10 to 30 MCI, 370 to 1,110 MBq. B. Carrier-mediated transport cerebral metabolism mechanisms. These are responsible for transporting glucose across the triple B. Agents such as 18 Fahrenheit's fludeoxyglucose aid in the evaluation of cerebral function by mapping the distribution of glucose metabolism. 18 Fahrenheit's fludeoxyglucose is produced by a cyclotron. 1. Biodistribution. Currently, there is a USP monograph for on-site cyclotron-produced 18 fludeoxyglucose, which is a glucose analog. 18 Fahrenheit's fludeoxyglucose concentrates in the brain, where it is phosphorylated but does not undergo subsequent metabolism because of the replacement of the hydroxyl group in the position 2 with a fluorine atom. It is then metabolically trapped for a sufficient time to allow imaging. 2. Decay data. A. Physical half-life 109.7 mins. B. Decay mode by positron emission. C. Primary radiation emissions 633 keV energy positrons and 511 keV G energy photons. 3. Administration and dosage. IV 5 to 10 MCI, 185 to 370 MBq. C. Cerebral neurotransmitter imaging. Fluorodopa fluoriniminous 1870 mRNA injection 1. Description. A. Cerebral neurotransmitter synthesis can be studied with fluorodopa 18 Fahrenheit's injection. The intracerebral distribution of this neurotransmitter tracer can be used in the assessment of neurodegenerative diseases such as Parkinsonism. B. Fluorodopa 18 Fahrenheit's injection exists under a USP monograph as an on-site produced sterile IV solution of a levodopa analog in which a portion of the molecule has been replaced with 18 Fahrenheit's. A positron-emitting radionuclide. 2. Biodistribution. A. After IV injection, plasma activity decreases to 10% of the administered dose within 5 mins after injection. B. Fluorodopa F injection is predominantly metabolized in periphery via dopa decarboxylase and catechol-methyltransferase. To maximize brain uptake, carbidopa may be used to decrease peripheral metabolism. C. Rapid excretion via renal system as dopamine metabolites. 3. Radionuclide data. CIXB2. 4. Administration and dosage. IV 10 to 20 MCI, 370 to 740 MBq. Cerebrospinal fluid, CSF dynamics. Radionuclide cysternography is useful in the evaluation of hydrocephalus and in detecting CSF leaks. In CSF imaging, the radiopharmaceutical Indiuminous 111 pentatate, 111 in DTPA, is introduced intrathecally into the spinal subarachnoid space, ascends through the basal cisterns, proceeds over the cerebral hemispheres, and eventually drains into the superior sagittal sinus. 111 in pentatate is commercially supplied as a sterile, pyrogen-free unit dose injection. It is produced by a cyclotron. 1. Biodistribution. A. After intrathecal injection, this radiopharmaceutical normally ascends to the parasagittal region within 24 HRS. B. After absorption into the bloodstream via the arachnoid villi, the major route of elimination is by kidney. 65% of the dose is excreted within 48 HRS and 85% within 72 HRS. 2. Decay data A. Physical half-life, 67 HRS. CSF biological half-life, 12 HRS. C. Effective half-life, 10 HRS. D. Decay mode, by electron capture E. Primary radiation emissions, 171 keV and 245 keV G energy photons. 3. Administration and dosage. Intrathecal, 500 MCI, 18.5 mbq/e, imaging dopamine transport 1. 123 ioflupane, 1-tridopamine-3 DATscan, is a cocaine analog that has a high binding affinity for presynaptic dopamine transporters, DATs, in the brains of mammals, in particular the striatal region of the brain. A feature of Parkinson's disease is a marked reduction in dopaminergic neurons in the striatal region. 123-ioflupane is indicated for detecting loss of functional dopaminergic neuron terminals in the striatum. In adult patients with clinically uncertain Parkinsonian syndromes, in order to help differentiate essential tremor from Parkinsonian syndromes related to idiopathic Parkinson's disease, multiple system atrophy, and progressive supranuclear palsy, ioflupane is unable to discriminate between Parkinson's disease, multiple system atrophy, and progressive supranuclear palsy in adult patients to help differentiate probable dementia with Lewy bodies from Alzheimer's disease. Ioflupane is unable to discriminate between dementia with Lewy bodies and Parkinson's disease dementia. 2. Biodistribution. Ioflupane, 123I, is cleared rapidly from the blood after intravenous injection. Only 5% of the administered activity remains in whole blood at 5 mins post-injection. Uptake in the brain is rapid, reaching about 7% of injected activity at 10 mins post-injection and decreasing to 3% after 5 HRS. About 30% of the whole brain activity is attributed to striatal uptake. At 48 HRS post-injection, approximately 60% of the injected radioactivity is excreted in the urine, with fecal excretion calculated at approximately 14%. 3. Decay data A. Physical half-life, 13.2 HRS. B. Biological half-life, 3.5 days. C. Decay mode, by electron capture. D. Primary radiation emissions, 159 keV, 27 keV, and 529 keV G energy photons. 10th. Infection and inflammation. Evaluation of sites of infection include the use of agents that can associate with components of the natural defense mechanisms and can accumulate where they localize. Gallium 67 citrate 1. Description A. It is supplied as a sterile, pyrogen-free radiopharmaceutical with preservatives. B. The mechanism of localization is thought to depend on the formation of a gallium transferrin complex in the blood and on binding to transferrin receptors associated with infection and inflammation. C. It accumulates in areas of white blood cell, WBC localization. 2. Biodistribution A. After administration, the highest concentration of 60-7 citrate, other than at the site of infection, is in the renal cortex. After 24 HRS, the maximum concentration shifts to bone and lymph nodes, but after 1 week, it is mainly concentrated in the liver and spleen. B. 60-7 citrate is excreted slowly from the body. 26% is via urine, and 9% is via feces. Whole body retention is 65% after 7 days. 3. Radionuclide data A. Mode of production, by cyclotron. B. Decay mode, by electron capture. C. Physical half-life 78 HRSD. Decay emissions 93 keV, 185 keV, 300 keV, and 393 keV G photons 4. Administration and dosage. IV for infection 3 to 8 MCI, 111 to 300 MBq. A daily laxative or an enema should be used by the patient after the injection and before the images to cleanse the bowel of radioactivity that may interfere with the images and possibly lead to a false positive result. Nuclear. Pharmacy 1171, 1172 Chapter 59X, B. WBC labeling agents. Radio-labeled WBCs are used in the detection of a wide variety of infectious and inflammatory processes. Current use includes the diagnosis of intra-abdominal abscesses, inflammatory bowel disease, appendicitis, fever of unknown origin, and osteomyelitis. WBCs can be radiolabeled with 111-enoxine or 99-MTC hexametazime. 111-enoxyquinoline solution. 111-enoxine. A. Description: 111-enoxyquinoline is supplied as a sterile preservative-free, pyrogen-free, radiopharmaceutical solution for use in the radiolabeling of autologous leukocytes. 2. 111 forms a saturated neutral lipophilic complex with oxyquinoline 1:3 ratio, which enables it to penetrate a cell membrane. 3. After incubation of 111-enoxyquinoline with a population of autologous leukocytes, the IN is thought to become firmly bound to cytoplasmic components, thereby allowing the free oxine to be released by the cell. B. Biodistribution 1. After radiolabeling, the autologous leukocytes are reinjected. 30% is taken up by the spleen, and 30% is taken up by the liver, reaching a peak at 2 to 4 HRS post-injection. 2. Pulmonary uptake is immediately evident post-injection, but it clears, with minimal visible activity, after 4 HRS. 3. There is a bi-exponential blood clearance. 9% to 24% clears with a biological half-life of 2 to 5 HRS, and the remaining 13% to 18% clears with a biological half-life of 64 to 116 HRS. 4. Elimination is mainly through radioactive decay. 1% is excreted in feces and urine during the first 24 HRS. C. Radionuclide data. Mode of production. By cyclotron 2 decay mode. By electron capture. Radioactive half-life. 67 HRS 4 decay emissions. 245 keV and 171 keV D. Administration and dosage. IV 200 to 500 MCI. 7.4 to 8.5 MBq 2. 99 MT HMPO. As a sterile and pyrogen-free IV injection after reconstitution with sodium pertechnetate, 99 MTC HMPO may be used to radiolabel leukocytes. A. Description: 199 MTC HMPO is a neutral, lipid-soluble complex that is able to penetrate the WBC membrane. This lipophilic complex is relatively unstable and rapidly converts to a secondary complex incapable of penetrating the WBC. 2. The methylene blue phosphate buffer stabilized solution is not able to radiolabel cells and should not be used. 3. Additional limitations on kit preparation parameters require the use of high mole fraction technetium generator ELUTSA. 2 HRS post-dilution from a generator previously eluted within 24 HRS. B. Biodistribution. 1. After IV injection, the radiolabeled cells localize in the lungs, liver, spleen, blood pool, bone marrow, and bladder. 2. Elimination is primarily via the liver. C. Radionuclide data. CII-BBC B3A Administration and dosage. IV for infection. 7 to 25 MCI, 260 to 925 MBq. She. Breast imaging. A. 99 MTC Sestamibi. 99 MTC MIBI. Exists as a sterile, pyrogen-free injection after kit reconstitution with Na 199 MT Co421. Description. A. 99 MTC MIBI is used for both breast and cardiac imaging. B. MTCM-IBI is indicated for planar imaging as a second line of evaluating breast lesions in patients with an abnormal mammogram or a palpable breast mass. C. 99 MTC MIBI may not be used to screen for breast cancer, to confirm the presence or absence of malignancy, or to replace a biopsy. 2. Biodistribution. 99 MTC MIBI is primarily excreted by the hepatobiliary system. 3. Physical properties. C2B3. 4. Administration and dosage. IV 20 to 30 MCI, 740 to 1,110 MBq. 12 tumors. The usefulness of radiopharmaceuticals in the detection of tumors varies in sensitivity and specificity, with differences in tumor location and type. 1. Gallium-60 Savinga. Citrate A. Description: 60 Savinga is supplied as a sterile, pyrogen-free radiopharmaceutical with preservatives. 2. The mechanism of localization is thought to depend on the formation of a gallium transferrin complex, or binding to transferrin receptors on tumor cells. Three, it accumulates in primary metastatic tumor sites and may detect the presence of Hodgkin disease, lymphoma, and bronchogenic carcinoma. B. Biodistribution. C. XA2. C. Radionuclide data. C. XA3. D. Administration and dosage. IV for tumor 10 MCI, 370 MBq. 2. 111 in pentatriotide A. Description: 1 is supplied as a sterile, pyrogen-free kit for the preparation of 111 in pentatriotide. The two-component kit consists of a reaction vial containing a lyophilized mixture of pentatriotide with stabilizer adjutants, and a second vial containing an 111 in chloride ferric chloride solution. The pentatriotide molecule is a conjugate of pentate diethylenedriamine pentacetic acid, DTPA, and octreotide, which is a somatostatin analog. B. 111 in pentatriotide is prepared by adding the 111 in div chloride solution to the vial containing the pentatriotide. The pentate portion of the molecule acts as a bifunctional chela, linking the 111 in radionuclide to the biologically active octreotide portion of the agent. 2. 111 in pentatriotide is indicated for localization of primary and metastatic neuroendocrine tumors expressing somatostatin receptors. B. Biodistribution. 1 within 1 hour after IV injection. 111 in pentatriotide distributes from the plasma to extravascular space. Less than 1/3 of the administered dose remains in the plasma 10 mins. Post-injection. 2. 111 in pentatriotide localizes as a function of somatostatin receptor density, with accumulation in normal pituitary, thyroid, liver, spleen, and the urinary bladder. 3. Elimination is primarily renal. 50% of the administered dose is excreted within 6 HRS post-injection, 85% after 24 HRS, and 90% after 48 HRS. Less than 2% of the administered dose is cleared via the feces within 72 HRS post-injection. C. Radionuclide data. One mode of production, by cyclotron 2 decay mode, by electron capture, their half-life, 67 HRs 4 decay emissions, 245 keV and 171 keV D. Administration and dosage. IV, 3 to 6 MCI, 111 to 222 MBq. 3. Iobenguin 1I injection. IMIBG. Description. It is supplied as a sterile, pyrogen-free radiopharmaceutical for use as an adjunctive diagnostic agent for the localization of primary and metastatic pheochromocytomas and neuroblastomas. Iobenguin methiobenzoguanidine, labeled with 131I, acts as a physiological analog of norepinephrine and is transported and accumulated in the adrenal medulla. This allows for the detection of neuroendocrine tumors via the specific uptake of labeled iobenguin. 3. Because of its physiological similarities to norepinephrine, many classes of drugs that interfere with catecholamine transport and function may affect the uptake and localization of labeled iobenguin. Nuclear. Pharmacy 1173, 1174, Chapter 59,000. B. Biodistribution 1. After IV injection, there is rapid uptake in the liver, with lesser amounts accumulating in the lungs, heart, and spleen. 2. Normal adrenal gland uptake is low, but for tumors such as pheochromocytomas and neuroblastomas, the uptake is relatively higher. 3. Elimination is renal. Most of the drug is excreted mainly unchanged. Between 40% and 50% of the administered dose is excreted within 24 HRS, and 70% to 90% is excreted within 4 days post-injection. 4. Administration of potassium iodide 1 day before and for 10 days after administration is suggested to reduce thyroid uptake of potential radioiodine contaminants. C. Physical data. CV8B2B-D. Administration and dosage. IV 0.5 to 1 MCI, 18.5 to 37 MBq. 4. 201 CI. This agent has utility as a tumor imaging agent because of its accumulation in the rapidly metabolizing cells of certain tumors in accordance with its mechanism of localization. CIIIA. A. Administration and dosage. IV 1.5 to 3 MCI, 55 to 111 MBq. 5 to 13 Fahrenheit fluodeoxyglucose USP. Currently, there is a USP monograph for on-site cyclotron-produced 18 Fahrenheit fluodeoxyglucose, which is a glucose analog. This agent has utility as a tumor imaging agent because of an increased demand for glucose by tumors with an advanced state of malignancy. Not only can 18 Fahrenheit fluodeoxyglucose locate and differentiate tumors, but it can also help distinguish between recurrent brain tumor and radiation necrosis in patients receiving radiation therapy. CIX. Biodistribution. 18 Fahrenheit fluodeoxyglucose concentrates in metabolically active cells, where it is phosphorylated but does not undergo subsequent metabolism because of the replacement of the hydroxyl group in the position 2 with the fluorine atom. It is then metabolically trapped for a sufficient time to allow imaging. B. Administration and dosage. 5 to 25 MCI, 185 to 370 MBq. B. Antibodies. C. Xifa. D. Itriomonas 90 ibritumumab tuxan and Indiomonas 111 ibritumumab tuxan B2. CXIV. Iodine I. Tositumumab. She. 3rd. Therapeutic agents. The therapeutic use of radiopharmaceuticals is based on the concept of selective localization of radiopharmaceuticals coupled with the lethality of the same because of the tissue damage resulting from highly ionizing particulate emissions such as B particles. Sodium iodide 131I, Therapeutic. 1. Description A. It is indicated for treatment of hyperthyroidism and thyroid carcinoma. B. Its therapeutic action is owing to the accumulation and retention of iodine and its isotope 131I. 2. Biodistribution A. C. V8, VT2. B. Biological half-life in the thyroid. Euthyroid patient, 80 days. Hyperthyroid patient, 5 to 40 days. 3. Radionuclide. Data. C. V8, B2, B. 4. Administration and dosage. Oral capsule or oral solution A. Hyperthyroidism, 10 to 30 MCI, 370 to 1,110 MBq. B. Thyroid carcinoma, 30 to 200 MCI, 1,400 MBq. 210 scored. Description A. It is indicated for the alleviation of bone pain arising from metastatic bone disease. B. As a metabolic analog of calcium, 89s are concentrated selectively in areas of increased osteogenesis, thus delivering a radiation dose sufficient to provide a palliative effect. C. Pain relief begins 7 to 21 days after administration, with maximum relief by 6 weeks and an average duration of 6 months. D. Reduction in patient analgesic usage occurs in up to 75% of patients treated. Complete pain relief is seen in 20% of treated patients, and no pain relief in 20% to 25% of treated patients. E. Bone marrow suppression effects limit 89s use to patients with initial WBC counts 2,400 and platelet counts 60,000. 2. Biodistribution A. After administration, 89s clears rapidly from blood and localizes in the bone hydroxyapatite. B. Initial biological half-life in normal bone is 14 days. Longer retention is seen in metastatic bone lesions. Between 12% and 90% of the administered dose is retained for up to 3 months after administration. C. Elimination is primarily renal. 66% of the administered dose clears via GFR within the first 2 days, and 33% is excreted via feces. 3. Radionuclide data A. Mode of production by accelerator. B. Decay mode by BC. Emission data 1.46 MeV maximum. B. Energy 100% abundance. D. Physical half-life 50.5 days. 4. Administration and dosage. IV 4 MCI 148 MBq. 4. It is 60 MCI kg, 1.5 to 2.2 MBq kg. C. Samaria minus 153. 153ism. Lexadronum 1. Description A. 153ism is indicated for the relief of pain in patients who have confirmed metastatic cancer of the bone. B. 153ism concentrates in areas of high bone turnover and accumulates more in osteoblastic lesions than in the normal bone. C. The goal of 153ism therapy is for patients to be able to reduce the amount of narcotic analgesics needed to control their pain. 2. Biodistribution A. The lesion to normal bone ratio is 5:1. B. The percentage of uptake of 153ism is directly proportional to the number of lesions the patient has. C. Less than 1% of the dose remains in the blood 5 HRS post-injection. D. 153ism is 100% renally excreted over 12 HRS. E. The onset is approximately 1 week. 3. Radionuclide data A. Mode of production by cyclotron. B. Decay mode by B and G decay. C. Physical half-life 46.3 HRSD. Decay emissions 640 keV, 710 keV, and 840 keV B energy and 103 keV G energy photons 4. And 103 keV G energy photons 4. Precautions. 153 may cause bone marrow suppression, which should return to baseline within 8 weeks post-injection. 5. Administration and dosage. IV 1 mkg 37 mbq/kg Yttriomonas 90 sani, ibrutinib tioxan and 111 in ibrutinib tioxan. 1. Overview 111 in ibrutinib tioxan and why ibrutinib tioxan are part of a therapeutic regimen used in the treatment of non-Hodgkin lymphoma, NHL patients with relapsed refractory, low-grade, follicular, or transformed B-cell NHL and patients with rituximab refractory NHL. B. Ibrutinib tioxan is an immunoconjugate consisting of a monoclonal antibody ibrutinib, which is linked to the chelator tioxan. C. The ibrutinib antibody is a murine immunoglobulin GON K monoclonal antibody produced in Chinese hamster ovary (CHO) cells. The ibrutinib antibody is directed against the CD20 antigen, which is expressed on the surface of normal and malignant B lymphocytes. D. The linker chelator tioxan provides a high-affinity chelation site for 111 in the case of the imaging dose and for 90 in the case of the therapeutic dose. E. The therapeutic regimen is administered in 2 separate doses. This allows for the qualitative evaluation of the biodistribution to avoid potential toxicities such as abnormally high bone marrow localization or prolonged renal excretion. In each administration, patients must be premedicated with diphenhydramine 50 mg and acetaminophen 50 mg 0.5 hours before receiving the rituximab infusion required before administering the radiolabeled antibody. 1. Step 1 is the administration of rituximab followed by the ibrutinib tioxetin diagnostic imaging dose, nuclear. Pharmacy 1175, 1176, Chapter 5970. D. 2. Step 2 follows Step 1 by 7 to 9 days and consists of a second rituximab infusion, followed by the 90 ibrutinib therapy dose. 2. Description A. Supplied as 2 separate kits to produce a single dose of ibrutinib tioxan and a single dose of 90 ibrutinib tioxan B. Each kit consists of 4 vials containing 1 ibrutinib tioxan and saline, 3.2 mg, 2 sodium acetate, 50 mm3 formulation buffer contains human serum albumin, 4 1 empty reaction vial C. Exists as a sterile, non-paragenic IV solution after formulation with either 111 or 93. Biodistribution A. The mean half-life for 90 ibrutinib tioxetin in the blood is 30 HRs. B. Approximately 7.8% of the administered dose is excreted in the urine over 7 days. C. The estimated biological half-life is 48 HRs. 4. Radionuclide data A. 111 C. Third B1C. B. 98 mode of production by reactor. Bohr 2. Decay mode by B. 3. Physical half-life 64.1 HRs. 4. Decay emission 935 mean keV 100% emission 5. Precautions A. 90 ibrutinib tioxetin should not be administered to patients with altered biodistributions of the 111 Ibrutinib tioxetan imaging and dosimetry. B. Why ibrutinib tioxetan should not be administered to patients with 125% lymphoma marrow involvement, 2 platelet count, 100,000 cells, lymphoma marrow control count, 1,500 cells MMM3, 4 hypocellular bone marrow, 5 history of failed stem cell collection. C. Ibrutinib tioxetan is contraindicated in patients with known hypersensitivity or anaphylactic reactions to murine proteins. D. Patients who have previously received murine-based protein therapy should be screened for human anti-mouse antibodies. E. Infusion-related adverse events, including asthenia, chills, and nausea, are common and are usually self-limited. Tumor lysis syndrome has been reported after rituximab infusions, which are part of 90 ibrutinib tioxetan therapy. Patients should be monitored closely for this potentially fatal adverse event. XV. References. 1. American Pharmaceutical Association. Nuclear Pharmacy Practice Guidelines. Academy of Pharmacy Practice, 1995. 2. Bernier Dr. Christian P.E. and Langen J.K. Nuclear Medicine Technology and Techniques. S&T. Louis, Missouri. Mosby, 1994. 3. Chilton H.M. Witkowski R. Nuclear Pharmacy. An Introduction to the Clinical Applications of Radio. Pharmaceuticals. Philadelphia, Pennsylvania. Leah Amp. Febiger, 1986. 4. Swanson D.P., Chilton H.M., Thrall J.H., eds. Pharmaceuticals and Medical Imaging. New York. N.Y. Macmillan, 1990. 1.7. Each of the questions, statements, or incomplete statements in this section can be correctly answered or completed by one of the suggested answers or phrases. Choose the best answer. 1. Which of the following emissions from the decay of radionuclides is most commonly used in nuclear medicine diagnostic imaging? A. X-ray. B. C. D. Positron. 2. Which of the following radionuclides is most commonly used in nuclear pharmacy practice? Gallium-67, 67 G. B. Thallium-201, 201 HL. C. Technetium 99 meters, 99 MTC. Duodenum 123, 123 I. E. Xenon 133, 133 X. 3. Which of the following radionuclides is produced using a generator? A. Technetium 99 meters, 99 NTC. B. Thallium 201, 200 meter. C. Gallium 67, 67 Ga. D. 133, 133 C. E. Iodine 123, 123. 4. Which of the following radiopharmaceuticals can be used in skeletal imaging? 99 MTC albumin aggregated, B. 99 NTC medronate disodium, Cl- 133 gas, USP, D. Thallus chloride, 201 ETL, USP, A. 99 MTC, disulfinate. 5. Which of the following radiopharmaceuticals is used in the diagnosis of acute cholecystitis? A. 99 MTC sulfur colloid, B. 99 MTC medronate disodium, C. 99 NTC albumin, 99 MTC exambitazimidine. 6. Which of the following cyclotron-produced radiopharmaceuticals is used for assessing regional myocardial perfusion as part of an exercise stress test? Thallus chloride 201 ATL USP, B. Sodium iodide 123 I, C. Gallium citrate 67 Ga USP, 111 in pentatate, E. 57 Co. Cyanocobalamin. 7. Glomerular filtration in the urinary collection system can best be evaluated using which of the following agents? 99-MTC sulfur colloid, 99-MTC albumin T-cysteamine-NTC albumin pen. Directions for questions 8-11. The questions and incomplete statements in this section can be correctly answered or completed by one or more of the suggested answers. Choose the answer. A if I only is correct. B if the third only is correct. C if I and Q are correct. D if second and the third are correct. E if I, 2 and the third are correct. 8. The definition of the optimal radiopharmaceutical includes which of the following attributes? First, short half-life. The second, photon with a 103,300 keV energy. The third, rapid localization in target tissue and quick clearance from non-target tissue. 9. Which of the following statements are true for sodium pertechnetate technetium 99 meters, 99 NTC, USP? Third, it is used to radiolabel all other 99 MTC radiopharmaceuticals. Tukun, the molybdenum 99 mo breakthrough limit is 0.15 MCI 99 Moki MCI 99 MTC 0.15 kbq mbq. Third, it has a physical half-life of 16 HRs. 10. Which of the following organs can be imaged with technetium 99 meters 99 MTC sulfur colloid? First, liver techum. Spleen. The third, bone marrow nuclear. Pharmacy 1177, 1178, Chapter 59. Lunivin. Which of the following radiopharmaceuticals may be used to image the thyroid gland? I. Sodium iodide 131I2. Sodium pertechnetate 99 MTC USP. Third, sodium iodide 123I. Directions for questions 12-16. Each of the following mechanisms of localization is most closely related to one of the following radiopharmaceuticals. The mechanisms may be used more than once or not at all. Choose the best answer. A. A metabolic trapping. B. Phagocytosis. C. Capillary blockade. D. Active transport. E. Passive diffusion. 12. Thallus chloride 201 ETL USP. 13. 99 MTC albumin aggregated USP. 14. 99 MTC sulfur colloid. 15. 99 MTC hexametazine. 16. 18 Fahrenheit's fludioxyglucose. Answers and explanations. 1. The answer is D. CIB3B. Current camera technology most efficiently detects G radiation. A and B emissions are not useful in nuclear medicine imaging because of their harmful particulate emissions and low tissue penetration. Although X-ray emissions can be used as in the case of the mercury daughter of the thallus chloride 201 ETL parent, they are not efficiently detected. Annihilation radiation associated with positron decay can be imaged, but this technology is currently limited to a few specialized centers. Two. The answer is C. C2A1. 99 MTC has become the radionuclide of choice in current nuclear pharmacy practice since its introduction in the mid to 1960s. 99 MTC fulfills all of the requirements of the optimal radiopharmaceutical, with its physical half-life of 6 HRS, 140 keV energy emission, ready availability cost, and ability to be radiolabeled to various biologically active compounds. 3. The answer is C2A1A. 99 MTC is obtained via commercially supplied, sterile, pyrogen-free generator system. A generator is a device used to separate a short half-life radionuclide from the longer-lived parent nuclide, while retaining the parent to produce more of the daughter nuclide. In this way, short half-life nuclides can be made available on a continuous basis at great distances from the sites of generator production. 4. The answer is B, C2. The 99-MTC diphosphonate compounds are the most popular bone imaging agents currently used in nuclear medicine imaging. They are rapidly taken up by skeletal bone. 50% of the administered dose is adsorbed onto bone hydroxyapatite, and the remainder is excreted by the kidney. The imaging advantages of the 99-MTC, coupled with the sensitivity of bone agent localization in skeletal bone hydroxyapatite, allow for detection of bone pathology before evidence of pathology can be shown by conventional X-ray. 5. The answer is E, C1-2. 99-MTC disophinin is an immunodeacetic acid derivative, which is useful for hepatobiliary imaging due to its ability to be selectively cleared by a carrier-mediated hepatocyte pathway. Lack of gallbladder visualization is an abnormal finding suggestive of acute cholecystitis. 6. The answer is a C31. Regional uptake of thallus chloride 201 EL-USP is proportional to myocardial blood supply. The injection of 201 ETL in concert with a treadmill exercise stress test determines myocardial perfusion at maximum cardiac output when cardiac demand outstrips supply and the distribution of 201 ETL is less after affected by collateral blood supply within the myocardium. Regions that do not take up 201 ETL are interpreted as areas of infarct or ischemia. If these focal areas of decreased uptake subsequently fill in with redistributed 201 ETL, they are interpreted to be areas of ischemia, in contrast with areas of infarct, which remain as diminished areas of activity. 7. The answer is E, C1. 99 MTC pentatate is cleared through glomerular filtration in the same manner as inulin and can be used to determine the GFR as well as in the evaluation of obstruction of vascular supply and renal morphology. 8. The answer is E, deuterium, CIC. The optimal radiopharmaceutical has a half-life short enough to minimize radiation exposure to the patient yet long enough to allow for collection of imaging information. It should incorporate a G-emitting radionuclide, which decays with the emission of a photon energy between 100 and 300 keV, which is efficiently detected with current instrumentation. The radiopharmaceutical should localize rapidly in the organ system of interest and be metabolized, excreted, or both from the non-target tissues to maximize contrast and minimize radiation absorbed dose. 9. The answer is C2AB. Sodium pertechnetate 99 NCC-USP decays by isomeric transition and has a physical half-life of 6 HRs. The emission of a G-photon has the energy of 140 keV. The answer is E. The 9-NTC sulfur colloid localizes within the reticuloendothelial system. 80% to 90% of the dose is phagocytized by the Kupffer cells of the liver, 5% to 10% by the spleen, and the balance by the bone marrow. The 11. The answer is E. I2, the CV8B. Although all of the listed agents accumulate in the thyroid gland, only sodium iodide 123I possesses ideal imaging characteristics in organification into thyroid hormone. Although the imaging properties of sodium pertechnetate 99 mTC-USP are good, the pertechnetate ion is trapped only by the thyroid and not organified, thus limiting the information provided by the image. 12. The answer is D, C3A1. Thallose chloride 201 ETL-USP is a monovalent cation with distribution analogous to potassium ion (CON). Myocardial uptake is by active transport via the neonicotinoid pump. 13. The answer is C, CVA1. After IV administration of 99 mTC albumin aggregated USP, 80% of the radiolabeled albumin particles become trapped by capillary blockade in the pulmonary circulation. 14. The answer is B, CVIB1. After the administration of 99 mTC sulfur colloid, 80% to 90% of the dose is phagocytized by the Kupffer cells of the liver, 5% to 10% by the spleen, and the balance by the bone marrow. 15. The answer is E, CXA1. 99 mTC hexametazine is used for evaluating brain perfusion. It possesses a lipophilic partition coefficient that is sufficient to diffuse passively across the triple B almost completely within one pass of the cerebral circulation, and that is sufficiently retained to permit data collection. (16) The answer is A, CIXB1. 18 Fahrenheit's fluorodeoxyglucose is used in evaluating cerebral function by mapping the distribution of cerebral glucose metabolism. As an analog of glucose, 18 Fahrenheit's fluorodeoxyglucose is transported into the brain by carrier-mediated transport mechanisms responsible for transporting glucose across the triple B. Because the presence of the fluorine atom in the position 2 prevents metabolism beyond the phosphorylation step, 18 Fahrenheit's fluorodeoxyglucose becomes metabolically trapped within the brain.